And to walk us through this breakthrough in science, let's bring in a consultant pediatrician, Professor John Okeniyi. He joins us live via Skype from Ile-Ife in Osun State. Good to have you join us, Professor Okeniyi.
Good afternoon.
Talk to us, because this has been touted as a breakthrough in science. How much of a revolution, or how revolutionary is this in terms of the treatment of malaria?
Malaria we are living in a malaria endemic region in Nigeria and most of sub-Saharan Africa, and it is the biggest health burden that we have. You just made mention of the deaths and the morbidity that comes with it, but also there is job loss, job absenteeism, school absenteeism, and other forms of things. Over millennia, as blacks, we've even evolved the sickle gene in the sickle cell disease. So this is the biggest disease affecting us in sub-Saharan Africa, and it has been challenging controlling it. We've tried environmental manipulations, we've tried with nets, barrier netting, and things like this. And what we have had is to live with malaria. It has been difficult to develop vaccines because the agent that causes malaria, the Plasmodium falciparum, changes phases in his life cycle, and it makes it difficult for the human body to recognize it and grow his own response effectively against it. Ultimately, as we age, we tend to grow the immunity well, but children that are below 5 years, from the age of 6 months, can be really worsted, and often they are the ones that die. Before the age of 6 months, they are well protected by their mother's immunity from breast, placenta, etc., and the feeding from breast milk. But till 5, when they've lost these things from breast milk and placenta, they can really be killed by this disease. So it's been difficult, and this is a major breakthrough. It's a major breakthrough.
And it's interesting. It's interesting you mentioned the Plasmodium falciparum, which is one of the variants of the bacteria of the bacteria. But we also know that there is another variant called the Vivax. Are we sure? And correct me if I'm wrong. The falciparum is the one we have here predominantly in Africa. Are we sure which of these variants the vaccine is effective against?
The agent that causes malaria is not a bacterium or virus. It is a protozoan. The name is Plasmodium, or Plasmodia in plural. It is carried into our body from infections, from bites of female Anopheline mosquitoes that bite at night. Now, there are various species of Plasmodia, but there are about 4 or 5 that affect human beings. And the one that is most fatal when it affects us is the Plasmodium, or P. falciparum. The falciparum is endemic in Nigeria, so it is a major problem. And this RTSS vaccine is effective against it.
Okay.
We also have others like the Vivax. Yes, we have P. Malaria and Ovale, but yes, this is very effective against the P. falciparum, which is the one that oftentimes kills.
Thank you for that clarification. But let's talk about the possibility. Now, we are dealing with the coronavirus vaccines issues as well. We know that it's been a great task trying to ramp up vaccination and vaccine production. So what is the possibility of having every child on the continent vaccinated soonest?
That will be the desire. Behind novelty, to move novelty to the field will require funding. And even up till now, it's not per se as if this is something that developed overnight. It has taken 6 years of hard work behind the line of developing this vaccine and piloting it. So the data is massive and impressive that this will work. It's been tried in Malawi, Kenya, Ghana, and it has proven to be very effective. It is homegrown because a lot of scientists involved in it are Africans, which is good news. The vaccination or act of immunization itself started from Africa. So This is coming back home, and we should encourage it. The African governments should support this. Funding agencies should do this, because we cannot say it is expensive. The alternative cost, the amounts of debt, the job losses, the school absenteeism, the amounts we spend on chemo prophylaxis, etc., is massive. If we continue all the other things we do against malaria, that is cleaning our environment, keeping the nets and things, and introduce this vaccine with education of persons, there should be acceptance. So far, it is said to reduce severity of disease by about 30%. That is significant. Why I say significant is the BCG vaccine, which is the first vaccine we give our children in Nigeria, that's the one against tuberculosis, is not even up to that. So this is a good vaccine.
And quickly, just before I let you go, we have had the certification of polio being eradicated in Nigeria. How hopeful are you that with this vaccine for malaria, that soon we will have the same reports concerning malaria in Nigeria and Africa?
Eradication comes at another level of disease. Malaria is transmitted by what we call a vector, the malaria, the Anopheles in the mosquito. So to eradicate this disease, we have to put in other factors into play, into consideration. Unlike polio, polio comes with one virus. It doesn't have multiple strains. It doesn't have any carrying agent like a host. So eradication of malaria is a different ballgame. We may not be able to consider that now, but it's a good step in the right direction if we are able to reduce this disease severity and, more importantly, continue the other environmental issues. We cannot say because we now have vaccines, stop using nets. We cannot say because of the simple things like clothing yourself and covering your sleeves, don't go out at night, and things like that, insecticides, and early presenting to the health centers early once you are ill, to have a rapid diagnosis. Not just thinking every febrile illness is malaria.
So basically, we have to continue to observe all measures in preventing malaria.
Yes, yes.
Thank you so much for your insight on this. This is good news. It's a great start. And we hope to see how it plays out. Thank you so much. Consultant Pediatrician, Professor John Okeniyi.
Thank you very much. You're welcome once again.